Hello and welcome. In this session I will reveal my tips on how to perform a good quality sample. The aim of the course is to obtain a sample with cells intact, in a sufficient quantity, without artifacts. Your ability to make a diagnosis, and a reliable diagnosis, depends on the quality of your sample. My 7 key points are as follows. Be bold. Using a small diameter needle, once you have penetrated the skin, the animal will not feel any discomfort, so you can use brisk, controlled movements to obtain good cell samples. Avoid bleeding, not just because red blood cells can be superimposed over the cells of interest, but also because bleeding can displace your sample cells in the needle. You risk having a non-diagnostic sample because the representative cells are simply no longer there. Be quick. It is vital. It is speed during the sampling process that ensures that your cells are intact. It is as important as the pressure you use during the smearing process. Sample at an angle to the lesion. It is at this level that you will obtain identifiable, representative cells with the least contamination. Always smear your sample. Do not apply too much pressure, but even when you have a very small sample, just several drops, it is always necessary to smear it. It is always necessary to dry your samples. If not, the cells will shrink down into themselves. You will not be able to observe the cell detail, and that is necessary to help you make a diagnosis. Avoid ultrasound gel. It absorbs the colour during the staining process, obscures the cells of interest, and at the same time stops the cells absorbing the stains as they should. One of the key factors in being quick is to have prepared your equipment in advance. Lay out your slides. 1 to 5 is ideal. It is better to have as many as possible to increase your chance of a diagnosis. Do not clean your slides. The slides are sold pre-washed, and in cleaning them again, you risk to increase your chance of artifacts. Choose frosted slides, which allows for easier identification, which is as useful for you in the clinic as for an external pathologist if you should send them away. The ideal way to identify your slides is with an HB pencil. Avoid at all costs any pen which contains ink, including indelible markers, as these disappear during the staining process. The needle I advise you to use is a 23 gauge blue needle. It is ideal for most types of sampling. You do not need a larger diameter. A larger bore needle is more likely to introduce hemorrhage, which you want to avoid at all costs. The needle needs to be wide enough to collect a representative sample and long enough to reach your lesions. Although an orange needle could be used in cats and small animals to increase their level of comfort, it is harder to reach the target organ, and it is often just a little bit too short. But with a blue needle, you will be able to reach the majority of organs, ensure the comfort of your animal, and decrease your risk of hemorrhage. I advise you to use a 5 ml syringe. For a core sample, it allows you to brace your hand to stabilize your movement and gives you control. If you come across liquid, it will allow you to aspirate easily. If you expect to aspirate liquid, I advise you to use a 3-way tap to make it easier. You also use the syringe to stabilize your hand during a fine needle biopsy or a stab technique. I advise you to add 1 milliliter of air into the syringe before sampling. This allows you to immediately expel the cells straight onto the slide, thereby improving the rapidity and the quality of your sample. Fine needle sampling is recommended as often as possible, even for skin and subcutaneous lesions. Scraping and impression smears often have deceiving results because there are often numerous contaminants, as well as adjacent inflammation or infections, which can mask the diagnosis. So wherever possible, even for ulcerated lesions, I really do advise you to perform a fine needle sample. When talking about a fine needle sample, we are actually talking about several things. A fine needle biopsy or stab technique is to be used in priority wherever possible. But a lesion can also be used aspiration, or a combination of the two. The stab technique is to be used when the lesion is a sufficient size, at least 1 centimetre. To perform this, you need to be confident with your movements. Move the needle backwards and forwards briskly in a stabbing motion on the same trajectory several times. You may sometimes hear that changing direction will increase your chance of a diagnosis, but in my opinion, all that you will actually increase is your chance of hemorrhage. So I strongly advise you to use several movements in the same direction and to perform multiple different samples of the same lesion if you wish to increase your chance of a diagnosis. So you pass through the skin, stab, stab, stab inside the lesion in the same direction, come out of the animal, place your sample on the slide, smear it straight away, then resample in another direction with a new needle. So under what circumstances would you use aspiration? For lesions of a small diameter, where there is no room to make the required stabbing motion. For lesions where there is a risk associated with movement, for example, if your lesion is next to the aorta. The trick to performing a good aspiration is not too much, not too long. You can pull back your piston to 2 to 3 mils maximum for a maximum of 1 to 2 seconds and repeat 4 or 5 times. If blood rises in the needle hub, you must stop straight away, discard the sample and start again. Because once again, a blood contamination will give you a non-diagnostic sample. The cells will simply have been washed away by the blood. Obviously, you will aspirate if the sample is liquid, not only to have a sample, but also possibly to drain an effusion. When to use a combination of the two techniques. Generally speaking, you will do this for masses that are fibrous or crepitant, if you suspect a mesenchymal tumour, for example, a fibrosarcoma. These cells are trapped within a matrix, so you will need to adopt a sampling technique that is a little more aggressive and combine the use of a fine needle stab technique with aspiration. When performing a fine needle biopsy, I advise you to always sample at an angle to the lesion, simply because these lesions often have a liquid or necrotic centre. This is even more true for large masses. In their case, the centre is rarely well vascularized and often necrotic. Performing your samples at an angle within the periphery of the lesion will increase your chance of having cells from the primary lesion. Here is a sample that is necrotic. Material from chromatin from the nucleus. It is pink, dark, and totally without detail. Only necrosis can be identified. Here is a second example where once again no diagnosis can be made. Here is an image which demonstrates a sample contaminated with ultrasound gel. As you can see here, it has strongly eosinophilic granules. The cells of interest here, the nucleus, have not stained as they should have done, which leads the sample hard to identify and the cells covered with gel. It makes it sometimes impossible to make a diagnosis. Wipe clean the animal, wash off with soap, use alcohol to clean the skin, and don't forget to clean your probe. If not, it will act as a contaminating source of gel on your sample. Avoid spraying the cells onto the slide. It will dry the cells and make them more likely to be damaged. Here you can see cells that have not been smeared. It is just a spray of material. And this is what it looks like under the microscope. Here is the presence of blood, and here in the centre there are cells of interest present, but it is impossible to make a diagnosis because the cells have not been smeared and are not sufficiently spread out. Here you can see how to perform a smear. Using the air preloaded in the syringe, place a drop of the sample carefully on the slide. Place a second slide on top and smear without applying pressure. Here you can see the resulting smear. So being quick is really important. It consists of preparing your slides in advance, pre-filling your syringe with air, placing your sample on the slide without delay, performing your smear rapidly, and quickly drying your slide. Here you can see to the left a sample where I waited 30 seconds between the end of the collection process and placing the cells on the slide, and to the right where the sample was placed and smeared immediately. The two slides are both a fine needle biopsy of a cat's lymph node, both performed by the same person. Here, there was a delay in performing the smear. You can see naked nuclei with a background of granular cytoplasm. It is impossible to make a diagnosis. Neither the cell type nor criteria of malignancy can be assessed. The second slide, where the smear was performed immediately, you can see round cells with a high nuclear to cytoplasmic ratio. The lymphocytes, large in size because they are generally bigger than the neutrophils identified here, with mitotic figures present with prominent nucleoli, which confirms a diagnostic of lymphoma. It is a high-grade lymphoma. So here, we can make a fairly specific diagnosis. The speed of sampling and smearing really does affect the quality of your samples. Just to draw your attention to fatty samples, what you can see here seems to be just liquid, because it is. It is a classic sample of a lipoma. This sample was performed with a fine needle aspirate. The adipocytes are ruptured. There is no cells on this side. If you wish to perform a diagnosis of a lipoma, you need to have tissue, which you will need to squash between the slide and the cover slip. You will see when you have tissue. If you only have droplets like those shown here, there is every chance that your sample will not be diagnostic. You need to have tissue and not just liquid, especially for fatty samples. So, in summary, be bold, be quick, label with a pencil, prioritize the use of fine needle samples with a blue needle or an orange in small animals. Prioritize the stab technique in the same direction each time. If you aspirate and you see blood, it is not worth keeping the sample. It will likely not be diagnostic. And if you use ultrasound gel, clean the animal thoroughly before sampling to avoid contamination. So that's it for this week. Thank you and see you next week for a new session which will be all about staining.